Hi, my name is Kristyn Robling. I am a third-year medical student at the Cherokee Nation campus, and today I will be talking about my research on disparities in diabetic foot examinations, a cross-sectional analysis of the behavioral risk factor surveillance system. So diabetes mellitus is becoming a big problem in the US. We're seeing more and more cases, and it can lead to a lot of serious health complications, such as cardiovascular disease, peripheral vascular disease, foot ulcer development, and then even amputations. So in order to prevent this, there are a lot of guidelines in place, and that includes annual foot examinations by a healthcare professional. But these are, while strongly recommended, they're not often utilized. So we wanted to investigate why that is. So we found in literature that diabetes often causes poor mental health, as well as poor physical health due to all the physical complications. And this can lead to a decrease in motivation to use preventative services, and that ultimately will lead to an increase in foot ulcer development. So our research was performed using a cross-sectional analysis of the 2021 behavioral risk factor surveillance system. And we used that data to analyze the relationship between getting the annual foot examination and having frequent poor mental health days, a depressive disorder diagnosis, frequent poor physical health days, and then a sedentary lifestyle. And we controlled for age, sex, race, ethnicity, health insurance, level of education, current smoking status, and then BMI. So for our demographic variables, we found that those who were in a younger age group were less likely to get an annual foot examination. Those who were female were also less likely to get their feet checked. Individuals who were Hispanic did not get foot checks as frequently as other ethnicities. And then those who did not have insurance also did not have their feet checked as frequently. The lower the education level, the less likely an individual was to get their feet checked. And then if they were a current smoker, they were less likely. And if their BMI was less than 25, they were also less likely to get the annual foot examination. So we found that those who had a depressive disorder diagnosis or frequent poor physical health days did not have a significant association between having those symptoms and not getting an annual foot examination. However, those who had frequent poor mental health days and a sedentary lifestyle had a significant association and were less likely to get their feet checked than those who had good mental health as well as an active lifestyle. So ultimately, we found that individuals with diabetes who had frequent poor mental health or sedentary lifestyle were less likely to get annual foot examinations by a healthcare professional. And we decided to highlight these groups because it's important that we tailor our treatment styles to the individual, and identifying these specific groups can help us recommend specific treatment modalities that will decrease their rates of complications. So for these specific groups, we recommend implementing increased mental health screenings at healthcare visits, offering counseling or support groups, and then creating exercise classes that are specifically designed for individuals with diabetes, and then educational materials that are targeted towards individuals who have poor mental health or a sedentary lifestyle to educate them further on the importance of foot checks and preventative care. So these are my references, and then my contact information is at the bottom. Feel free to contact me if you have any questions, and thank you so much for listening to my presentation.